Breastfeeding is often viewed as a natural form of contraception, but this belief can lead to unintended pregnancies if misunderstood. While it's true that breastfeeding can delay ovulation due to lactational amenorrhea, a temporary absence of menstruation, it is not a foolproof method. The hormone prolactin, which stimulates milk production, suppresses the hormones responsible for ovulation. However, this effect is not guaranteed, as ovulation can return unpredictably, even before a woman's first postpartum period. The 5-6-month rule is a crucial guideline. Exclusive breastfeeding, feeding on demand, day and night, with no other food or formula, may provide some contraceptive protection for up to 6 months postpartum. But this requires strict adherence, as introducing supplements or spacing feeds too far apart can reduce its effectiveness. Additionally, once menstruation resumes, fertility typically returns, even if breastfeeding continues. Understanding these hormonal changes and ovulation patterns is essential for making informed decisions about contraception. Relying solely on breastfeeding for pregnancy prevention can be risky, so it's important to discuss alternative methods with a healthcare provider to ensure both maternal and infant health are protected. Clear communication and education can help dispel myths and support healthy family planning. Breastfeeding mothers must carefully consider their contraception choices, as not all methods are safe or suitable during this time. While breastfeeding naturally suppresses ovulation for some women, known as lactational amenorrhea, this is not a foolproof method of birth control. Hormonal contraceptives, such as progestin-only pills, mini pills, are often recommended because they are less likely to interfere with milk production. These pills contain synthetic progesterone, which mimics the hormone already present during breastfeeding, making them a safer option. However, combined hormonal methods containing estrogen, like the regular birth control pill or the ring, may reduce milk supply and are generally not advised, especially in the early postpartum period. Non-hormonal options provide alternatives for mothers who prefer to avoid hormones altogether. Barrier methods, such as condoms, are safe and have no effect on breastfeeding. The copper intrauterine device, IUD, is another popular choice, as it is hormone-free, highly effective, and long-lasting. Timing is also crucial. Some methods can be started immediately after childbirth, while others require a waiting period. For instance, progestin-only pills can often be initiated shortly after delivery, whereas an IUD may be inserted at the postpartum checkup. Consulting a healthcare provider is essential to determine the best option based on individual health, breastfeeding goals, and future family planning needs. Personalized advice ensures that contraception supports both maternal and infant well-being without compromising breastfeeding success. Balancing breastfeeding and family planning requires careful consideration to support both the mother's health and the baby's nutritional needs. While breastfeeding can delay ovulation, relying on it as the sole method of contraception is risky, as fertility can return unpredictably. Spacing pregnancies by at least 18 to 24 months allows the mother's body to recover, reducing risks like preterm birth and low birth weight in subsequent pregnancies. Tracking fertility signs, such as cervical mucus changes or basal body temperature, can help identify when ovulation resumes, but these methods require consistency and awareness. Integrating contraception into postpartum care is crucial. Options like progestin-only pills, non-hormonal IUDs, or barrier methods can be used without disrupting milk supply. Healthcare providers play a vital role in guiding mothers towards safe and effective choices tailored to their breastfeeding journey. Studies show that when mothers are well informed about their options, they can better align their family planning goals with breastfeeding, leading to improved health outcomes for both themselves and their children. Open communication with partners and medical professionals ensures a supportive environment for making these decisions. Ultimately, balancing these aspects empowers mothers to nurture their current child while planning for the future with confidence.